For Session Update, I'm Shannon Lurkey. Comprehensive legislation to curb the opioid epidemic has been introduced in the House and the Senate. Chief authors of the bipartisan bills provided details to the press about the proposals which stem from the legislation passed by the Senate last year. Here's that media event.
All right, good morning. I'm Representative Liz Olson. I represent District 7B, and I also serve as the Majority Whip in the House. And today I'm here as the author of our opioid stewardship bill. And I just want to say that reason why we're doing this is incredibly important and timely, even on a very, very cold day. That in communities across the state, it appears that this opioid crisis that we're in really has no end in sight. Without this swift legislative action, there indeed might not be an end. Parents have lost children, teachers have lost students, our first responders are asked to respond to impossible situations, and no other family deserves to go through this, and Minnesotans expect us to take action, enacting comprehensive treatment, prevention, recovery strategies to end this crisis. And so I'm proud today that on Monday, we introduced on the House side House File 400, which is a bill that will have its first hearing today in the Health and Human Service Policy Committee. This is a bipartisan bill that I have worked closely with Representative Dave Baker, who you'll hear from in a minute, and others to pick up where we left off last session. Last session, we had a lot of conversation on both the Senate and the House side, and with the work of Senator Rosen and Senator Eaton, got a long way on coming up with solutions. So I pick up where they left off last session, and so we have a bill in front of us that is going to hold accountable, which has not been held accountable before. We're asking manufacturers and distributors to pay their fair share into a crisis that they helped create. So you'll see that we are going to be generating about $20 million of revenue into our state to help fight this crisis. From that, we will be appropriating money to a variety of places, both places that are tested and true in the treatment and prevention methods that they have used. I'm also proud to say that we're going to be expanding some options. Last Friday, we were in Mille Lacs, and we heard from tribal communities that have been deeply impacted by this crisis. So you'll be seeing today that we'll also be talking about how we can be spending the resources we bring in through this new revenue generation to work directly with tribal communities in culturally sensitive and culturally appropriate ways to fight this crisis. So this is the beginning of the conversation. We're going to continue to talk about how we do this work together. As legislators, we come to this because we have to. Our communities are asking us to do something. And so it's through this bill that we are bringing action forward, that we continue to have this conversation, and at the end of the day, invite people to be a part of the solution with us. And with that, I will turn it over to Representative Dave Baker.
Thank you, Representative Olson, and good morning, everybody. My name is David Baker. I am representing District 17B in Candihoy County. Been working on this industry, or this bill, for a number of years. Most of you know I've got a personal side to this as well with my son Dan. Lost him in 2011, and it has sort of helped fuel me to understand this issue better than I ever would have had I not, or my family had not been involved in this thing. So this bill has been in the works for a number of years. It just gets better as it goes along, and this is the year we're going to get it done. I want to give a lot of folks in the past, again, a lot of credit for where we're at today. In the past, Representative Matt Dean, our former chair of the House Committee, worked hard on these bills to get community pharmaceuticals and some education out there for docs. Representative Mary Kunish-Pudin helped us write a great K-12 education bill so kids better understand the effects of addiction. Representative Kresha up in Morrison County helped us create a bill to get community grants out to docs around the state so that we get more medically assisted treatments out to folks around the state. So this has been a work of a lot of people over the last couple of years. And what we have behind me right now are members of our bodies, both the Senate and the House, that I could not be more proud of to be working with. We have been meeting, honestly, for 8-9 weeks, every week, all four of us and our staff, to make sure this bill is ready for today. It's not a perfect bill, and we're going to make it better as it moves along. But I can't tell you enough how bringing reform to this conversation, bringing new ideas and some new revenue so it's not all on the taxpayers' backs, is a good bill. I just returned from New Orleans with a opioid fellowship program. 25 other states were represented there. we are the one and only state that really is this close to getting something with a very good, basic plan to bring some more folks and some more resources to help our families. So with that, one of our next champions is Senator Julie Rosen, who has carried this in the Senate, and I'm honored to represent and introduce her today too.
Good morning. I am Julie Rosen, and I stand very proudly with Senator Eaton on this bill. Folks, we have a bill. It just showed up this morning, Senate File 730. I'm very, very excited about this bill. We have Senator Eaton as a chief author, and Senator Draheim, Senator Abler, and Senator Klein as our chief authors. So it is absolutely a bipartisan bill. It's going to be a better bill than we had last year. And as Representative Baker said, we've been working together on this, on the path going forward in each body. This issue has not waned at all. In fact, it is getting worse in the state. And people are asking for the state, the legislature, to do something about this issue. Because frankly, the government, the demand on government is so strong, so high, and on public programs, it's unsustainable what we have right now. And I am the chair of finance, and so it's very important to me. We have to build a budget this year, but we cannot sustain these costs that the opioid crisis is bringing to our state. So when you talk about the cost to government, the cost to the counties, I can't even begin to tell you what it's going to be the cost to the families and to our children. I fortunately don't have a personal story of why I'm doing this. I'm doing it because it's the right thing to do. I wake up every morning and I say, we need to address this issue. And by addressing it, that means everyone is around the table. And so we've brought the providers, the prescribers, the treatment community, law enforcement, the prevention aspect of it. We've brought, kicking and screaming a little bit, the manufacturers and distributors who absolutely had a play in this. We're not asking that much of a contribution from them to do business in Minnesota, but we do think they have skin in the game. So that is why we have a licensing fee increase right now. To do business in Minnesota for a manufacturer and distributor, they pay $235. That's it. One of the lowest in the nation. And as I said, and what we both of our bills are succinct in that, we're asking for an increase on the licensing fee. There are other questions that have come about, particularly some folks that came to the Capitol yesterday claiming that we are taking their opiates away for their chronic pain. There's no intent of either one of these bills to do that at all. We are addressing the acute pain issue, and of course the chronic pain issue is always going to be there. And I would encourage anybody that has questions or concerns about the bill to actually read it, because we have addressed every single one of those concerns. When we're dealing with chronic pain issues, if they read the bill, they will see that we have put in professional clinical judgment, and that was language given to us by the Minnesota Medical Association that says the doctor has the ability to adjust and work with the patient on their best clinical judgment. So I think we've addressed that. And like I said, please read the bill. It's a very, very good bill. It is something we owe this to Minnesota to get this done, and this is the year we're going to do that. With that, I'd like to turn it over to Senator Eaton.
Well, thank you. I'm so honored to have worked with Julie Rosen on this bill. Senator Rosen has just been a champion, as Senator Baker was or Representative Baker, so I didn't mean to demote you. Representative Baker last year and Representative Olson is this year. It's been a lot of work, and we've worked well together. The personal story that I have, most of you know, I lost my daughter in 2007 to an opioid overdose, or to addiction, which is more accurate. And I don't want other families to go through the trauma that I did. I mean, all the way down to her aunts and uncles and cousins, and I mean, everybody was traumatized by her loss. And that happened to over about 400 families last year, just from opioids. So we don't want to do that to this generation, not to mention how many we've lost to this disease and how many we've lost to people with active addiction that aren't able to manage their addiction. It is a disease. I'm hoping that with our bill, we get it more out of the criminal justice system. This needs to be in the medical system. This needs to be as common a part of a physical as checking your blood pressure or checking you for diabetes. People should be assessed for addiction. It is a disease. And if we catch it early, we don't end up with all these expenses. This is costing, the only numbers I could find is $1,339 a person in Minnesota a year. And I'm not sure how accurate those are. That was from one small organization. But that really comes down to roughly $6 billion a year. And majority of that's coming out of people's taxpayers' money, pockets. It's coming out of the counties from your property taxes. It's, this is not something that is just being taken care of, that now we're picking on the pharmaceutical companies and distributors. You've been paying for this for the last few years. I would say for at least the last 9 years. And it's time that they step up. And they've come to my office, and I've asked them to, put some skin in the game, and they explain to me how small their profit margin is and how they just can't afford this bill. Well, I don't buy it. Most of them made billions of dollars last quarter. I've seen the numbers, and it's time. So I hope we get this bill passed and we can start making a difference in this state. Thank you. Anybody want to close?
We can just do questions.
Any questions?
Senator Rosen and perhaps Senator Eaton. So, based on the comments that Senator Eaton just made, has Big Pharma and the distributors, have they agreed to the provisions in this bill, or are they going to oppose it?
I actually do not know what their stand is on the bill. The bill really hasn't changed. I think it's gotten better as far as the fees. They're a little more dispersed. They're not so volatile and heavy on the top three. They didn't even come to my office last year at all. This year, they're coming to the office. They're bringing people from their home office to talk, and they explain that they want to be a part of the process, to help. And I asked them, what does that look like? And I have not received an answer. So my plea to them is that you can be a part of the process. You can help us with this. Help us figure out how we are going to save the next family and child. And they have not done this yet. So the increased licensing fee is something New York did, and they got sued because they had a clause in there that said you cannot pass on the cost to the consumer. And that is one of the concerns, is the cost to the consumer. And we, as Senator Eaton and everyone knows behind me here, the cost to the consumer is, we can't even measure what it's costing our families and government and public programs and our counties. So if there is a pass, if they pass the cost down, it's going to be so minuscule. It will be 1/10 of 1 penny onto a prescription pill because of their revenue profits.
So there's not a prohibition against passing it on?
No, there never has been on either bill. And if there is some lawsuit that comes out, the Attorney General will be handling that.
Just one quick follow-up, if I may. If Big Pharma and the distributors are not part of this, or they come in and they say, yeah, we want to be part of it, but ultimately they're not part of it, or you can't get an agreement with them, have you got the votes to pass it in either chamber?
Yes. Yeah. Would you guys like to mention something?
So,
I want to make it clear, though, that it's a bipartisan effort, and it will pass off the chamber. So we're still working with our caucus, and we're basically asking everybody calm down. We're getting figures from the counties how much it's costing for their out-of-home placement cost. That is near and dear to every one of us here, and everyone in our caucuses, that what's happening to the families and the children because of this drug addiction. So. There is work to be done in both caucuses, and it passed off the Senate floor last year 60-6.
But without work being done, have you got the votes, or you still got some people you got to convince?
Well, there's always education that's involved with it. And as I said, I think the education is an easy sell when we have time to sit in front of the caucus. I'm having working groups, opioid working groups with members. And there's fears. There's always fears when you have a bill like this that brings everyone to the table. But you've got some big lobbyists out there, too, that are not helping the situation also. So we are on the education path right now. And I just plead to all the members in the Senate to listen to both of us, give us a chance to talk about the bill.
And if I just could follow up on one comment on that as well. As Senator Rosen is stating, this is not an easy bill to lift. We are actually creating a legacy bill here that 201 legislators are nervous about, and for good cause. We're creating this legacy fund that will be very laser focused, that'll go into a stewardship fee fund, not the general fund, and it's going to be isolated and identified for people on our advisory team that will help the commissioners spend this money to the very best use and our leverage with our state dollars. So I like it because it's creating this new thing that we haven't seen yet. Again, there isn't anything like this in the country. So for good reason, our members are cautious and they want to make sure the bill looks right. It's lawful. Everything is lined up. We feel strongly that it is. And it's now our job to help sell the rest of our team why this is a great idea. And that's why you're going to see, I believe, a very strong bipartisan support on both bodies, and hopefully will be signed into law by the governor. But this is a big bill.
So the bill is looking to get $12 million, I just read it, $12 million out of the manufacturers and $8 million out of the distributors. And it looks like it's going to be prorated based on how big they are, essentially. So can you give a range as to what the fee is going to be on these manufacturers and these distributors? If it's $235 now on everybody, what's it going to be under this?
The very top that they can have for the manufacturer distributor is $500,000. So, and then it's prorated down for the distributors, units dispersed, and for the manufacturers, it's how many is sold in Minnesota. And unfortunately, I don't have my figures as far as how much is. Do you remember how many? It's an amazing amount of prescriptions that are sold in Minnesota. And I should mention, emergency room costs. Our emergency room visits have gone up 135%, and you know the ongoing cost to our counties is incredible. So this is going to bring them to the table, and I hope they stand by us at some press conference and say, "Yeah, we want to be there."
That is quite a percentage increase from $235 to hundreds of thousands, and I think you said at the news conference last week that Wisconsin has 5,000, I think, is there?
Currently. Mm-hmm.
So is that part of where you're expecting the fight to be here, the large percentage increase?
You know, I think is it a fight or is it just a reality check? This is your contribution to the state. We're spending billions of dollars on an issue that you helped create, and I don't think we're asking for a lot for the amount that they are shipping and manufacturing for the state of Minnesota, and the amount of deaths that we've had. Does anybody want to contribute to that?
Can I ask you about this more recent appearance of pharmaceutical company lobbyists coming to talk to you folks? You said that they had not visited you last year. Can you explain a little bit more about, were there requests by you to meet with them? Did they refuse to meet with you last year? Were they just phantoms, in the back of committee rooms? And what do you think has changed this year to cause a change in lobbying strategy, at least?
I don't know what the change is on their behalf. I do know that last year and this year I invited them all, and this is the first year they came. They didn't seem to have any kind of plan or anything to tell me when they came, just to tell me about their industry and how small their profit margin was.
And I would just say, if you look at last year, how this all transpired, these bills have been around. The Senate passed a great bill off the floor. The House had it amended, Representative Baker put forward a good bill last year that had bipartisan support. It didn't get anywhere. So I think you can look behind what happened there and find out it's a new day. There is a shift in, a split government now. And so I think a new reality is upon us. And so I think we're going to see more people coming because of the reality that we're going to pass this year. The House is committed, our DFL House caucus, working with our Republican caucus and working across that it feels like a new day and a new commitment, and therefore you're going to see new opposition.
And I should add, the governor is committed to this. We've had a chance to speak with him very recently and encouraged him to reach out with the manufacturers and distributors to talk to them too about their concerns. But as they said, they've come now to the office with their lobbyists that cover certain districts and say we want to be a part of the solution. And I keep asking, what does that look like to you? And I'm still open. What does it look like to you?
Last year's proposal, or one of the things that people talked about was the penny a pill, and now we're talking about a licensing fee. Are we basically looking at the same amount of money and it's just being targeted differently as to who pays what?
That's a great question. Yeah, basically the same amount of money. We were kind of shooting last year for $15 to $20 million. What we learned about the penny a pill model, which is based on morphine equivalents, so the stronger the pill, the more cents per penny pill. So again, it was confusing. There wasn't a good national study or a model or a requirement of what is an actual morphine equivalent that was clearly identified. So we were trying to clean up possible litigation issues. So this licensing fee reform should be much cleaner, much simpler to follow. It's tracked by the Board of Pharmacy with the pills that come into Minnesota. So I think this is just, again, about the same number. I think what the chief authors are saying today, we are hard numbered on this $20 million. That's just about 10% of the state funds now going to chemical support. That's a small part. So I think that, again, the numbers are right, but on average it's about the same as what the penny model was based on last year.
Good job. Yeah. Wonderful. Well, thank you very much.
Thank you.
We'll see you in committee. Thank you very much.